One of our specialties here is diabetic foot care. So many people ask, what is it so special about diabetics that brings them to the podiatrist? Well, there are multiple things they're at risk for, so that we need to check them and make sure they don't have these problems or that we catch them early and treat them. One of the biggest things is that diabetes can affect their circulation. So they have decreased blood flow to the feet, which means slower healing and greater risk of problems such as non-healing wounds and infections. They also can have neuropathy, and neuropathy can take a few different forms. People can have pain, pins and needles, tingling, electrical sensations, and that can occur as well as numbness, where they lose feeling. When they lose feeling, it becomes very dangerous. They can have an open sore, not even realize it. It may develop an infection, and until it becomes very swollen and painful, or they become very sick, they might not even notice that infection. So we want to check people carefully, make sure there are no signs that the skin may be breaking down. We'll look for certain deformities. We'll look for things like corns and calluses. They're an indication of pressure that could lead to an open skin wound and a potential problem in the future. Patients also have difficulty healing with diabetes, and much of that has to do with blood flow on a microscopic level, where they're not getting the nutrients they need to the tissues to heal them and the oxygen they need to the tissues. So we want to inspect them carefully. We want to empower the diabetic patient to check their own feet, check them every day, look for signs of any kind of skin breakdown or any problems. We want them to use moisturizing creams every day so that the skin doesn't become dry and cracked as another source of infection. We want to check their nails, make sure they don't have thick fungus toenails that could form some irritation or even open sores under the nails. Check for ingrown nails. We check between the toes for any athlete's foot, cracks, openings, again, that can become infected. If they have any type of foot deformities that may be at risk for rubbing in a shoe and causing a problem, we may get them into diabetic shoes. A little deeper and wider, no seams to irritate them, special inner soles that we heat mold to their feet to reduce high pressure areas, all that we can do to reduce their risk of having problems. When they do have problems, we treat them here. We do quite a bit of wound care. We may prescribe antibiotics. We may make changes to their shoes, or if it's a serious case, they may have to actually go into the hospital. We see people at the hospital to take care of their infections, sometimes requiring amputations. If that occurs, we follow up in the office with any wound care needed and maybe any kind of special shoes or even just inserts in the shoes to help with their balance and gait. So if we keep a close eye on diabetics, and most especially if they keep their sugars under control and check their feet every day, call us if there's a problem, then we can prevent some of these terrible things from happening.